Prenatal development. The process of prenatal development occurs in three main stages. The first 2 weeks after conception are known as the germinal stage. The third through the 8th week is known as the embryonic period, and the time from the 9th week until birth is known as the fetal period. Teratogens. A teratogen is a substance that can cause abnormalities or birth defect in a developing fetus. Common teratogens include some medications, recreational drugs, tobacco products, chemicals, alcohol, certain infections, and in some cases, uncontrolled health problems in the birthing parent. Many independent prospective studies have now shown that if a mother is stressed, unconscious, or depressed while pregnant, her child is at increased risk for having a range of problems, including emotional problems, ADHD, conduct disorder, and impaired cognitive development. Nutrition. Nutrition is a key regulator of fetal growth as a mother provides the macro and micronutrients that both the fetus and placenta require to grow. Several experimental and epidemiological studies have shown that undernutrition of mother impairs fetal growth. Exercise. 5 to 8 women who exercise throughout gestation show significant decreased risk of preeclampsia, hypertension, gestational diabetes mellitus or GDM, weight gain, rate of spontaneous abortion, congenital abnormalities, and incidence of preterm labor, and offspring have normal growth and development. German measles. Pregnant women who contract rubella are at risk for miscarriage or stillbirth, and their developing babies are at risk for severe birth defect with devastating, lifelong consequences. CRS can affect almost everything in the developing baby's body. Prenatal care. Prenatal care is when you get checkups from a doctor, nurse, or midwife throughout your pregnancy. It helps keep you and your future baby healthy. Endocrine irregularities. Your body normally undergoes rapid changes during pregnancy for the development of your child. However, hormonal imbalances can indicate endocrine problems that can occur during pregnancy as part of a pre-existing or new condition. Environmental. During prenatal development, environmental factors can significantly affect the development of a child. Most everything the mother ingests, including food, liquid, and even medication, travels through the placenta to the fetus. Anything the mother is exposed to in the environment affects the fetus. Incompatible blood type. If a baby's and mother's blood are incompatible, it can lead to fetal anemia, immune hydrangeas, or erythroblastosis fetals, and other complications. The most common type of blood type incompatibility is Rh disease, also known as Rh incompatibility. The Rh factor is a protein on the covering of red blood cells. Moral development is the process through which children develop proper attitudes and behaviors toward other people in society based on social and cultural norms, rules, and laws. Moral development is the concern for every parent, teaching a child to distinguish right from wrong and to behave accordingly is a goal of parenting. In moral development, it includes the empathy, the capacity to understand or feel what another person is experiencing from within their frame of reference. That is, the capacity to place oneself in another's position. Definition of empathy encompasses a broad range of emotional states. Intelligence. More specifically, we expect intelligence-related differences in reasoning about moral judgment. Furthermore, we expect a positive correlation between intelligence and moral motivation, as well as between intelligence and negatively balanced moral emotion, which are both also indicators of moral development. School, the way they feel toward peers, teachers, staff, and leaders at school will affect their moral life. They feel guilty because teachers blame them if they fail. They start to develop negative behavioral traits. The relationship children develop in schools become critical to their positive development. Society and culture. Culture refers to the outlook, attitudes, values, goals, and practices shared by a group, organization, or society. Interpretation of what is moral is influenced by cultural norms, and different cultures can have different beliefs about what is right and wrong.
Good day everyone. For today's video, I will going to talk about intellectual development.
Intellectual development. Cognitive development is a field of study in neuroscience and psychology focusing on a child's development in terms of information processing and conceptual resources, perceptual school language, and other aspects of the developed adult brain and developed psychology. These are the category of intellectual development. First is economic status. Socioeconomic status is an economic and sociological combined total measure of a person's work experience of an individual's or family's economic access to resources and social position in relation to others. Next is heredity. Heredity is the biological process responsible for passing on physical traits from one generation to another. Next is environment, the nature world as a whole or in a particular geographical area, especially as affected by human activity. Maturation, the action or process of maturing. Next is learning, the acquisition of knowledge and skills through experience, study, or by being taught. We have also health and physical condition. Physical health can be defined as normal functioning of the body of all levels. Last is experience, practical contact with and observation of facts or events. Next is social development. When we say social development, is about improving the well-being of every individual in society so they can reach their full potential. So, therefore, these are the social development categories. First is family. Their families will also do well in the whole of the society will benefit. Next is punishment. Social punishment is a mechanism by which cooperative individuals spend parts of their resources to penalize defectors. Next is sibling relationship. Also influences the development of children's social and cognitive skills. We have also environment. Global environmental changes such as pollution, climate change, biodiversity loss, and freshwater decline after people worldwide, with impacts that are not just physical but also social and economic. Culture. Socioculture theory is an emerging theory in psychology that looks at the important contribution that society makes to individual development. Socioeconomic status encompasses not just income, but also educational attainment, occupational prestige, and subjective perception of social status and social class. Next is participation in social organization. It's defined as a person's involvement in activities that provides interaction with others in the society or the community and expresses interpersonal interaction outside the home. School program, social development refers to the process by which a child learns to interact with others around them. Next is emotional development. When we say emotional development involves learning what feelings and emotions are, understanding how and why they occur, recognizing your own feelings and those of others, and developing effective ways for managing those feelings. These are the emotional category. First is maturation. In other words, emotional maturity is when someone can manage their emotions no matter their circumstances. Next is learning. Social emotional learning is a methodology that helps students of all ages to better comprehend their emotions. Physical condition involves learning what feelings emotions are, understanding how and why they occur. Environment, it involves the surroundings and the people in society. Hereditary factors, we are predisposed to acquire a certain emotional response because our parents or grandparents had them. When we say training, it can help us to manage our emotions. Next is health. Health is most important because it can affect our emotion. Family relation. A family shares emotional bonds, common values, goals, and responsibilities. That's all, and thank you for listening.
Good day everyone, I am Darcy Nelam Sirabi and I'm going to present to you the motor development. So motor development means the physical growth and strengthening of child's bones, muscles, and ability to move and touch his or her surroundings. For example, if a child is able to crawl or walk, gross motor skills, he or she can more easily explore their physical environment, which affects cognitive development. So the first one is nutrition. So the relationship nutritional status with gross and fine motor skills has the correct correlation value of 0.650 and moderate relationship level. We also have the immunization. We have also the small example, which is that if mother and child both are immunized at a proper time, it leads to good sensory motor development. Yun yung mga relation ng immunization sa motor development. So we also have the environment. Love and security help the child to take the risk, to explore fearlessly, and to know more about the environment, which leads to a better sensory development. The child's environment has a large effect on their motor skills development. The more opportunities they have to develop both gross and fine motor skills, the faster their capacity increases. We also have the opportunities. While these skills are trainable throughout childhood, the windows of opportunity are considered a prime time for children to be exposed to proper movement mechanics. So dito rin we have also the prior to PHV between the ages of 6 to 8 years in girls and 7 to 9 years in boys. We also have the illness and physical. Motor development is important throughout the child's early life. Kasi nga, physical development is tied to other development areas such as if a child is able to crawl or walk. Yung kanina, katulad lang sa ano kanina, sa we have also yung kaninang introduction. So the intelligence. Although individuals with a lower measured IQ more often showed poorer motor performance than those who are higher measured IQ motor skills, at all levels of proficiency was seen in all IQ categories. The age of reaching developmental milestones was associated with intellectual performance at age 8 to 26 and 53 years. The size of the body. It starts from the inner body, including the head, neck, arms, legs, and then moves to the outer body such as hands, feet, fingers, and toes. Motor development is important throughout the child's early life because physical development is tied to other development areas. So the fear, although anxiety disorders are not physical maladies, they can affect your ability to perform physical work. So, minsan, di siya masadong nakaka-effect sa motor development. Those who have panic attacks, shaking, or other common effects of anxiety disorders may find it difficult to perform tasks which require fine motor skills. the last one. I think we have the last one. So the hampering clothes, the ability to complete the functional task of dressing requires various gross motor skills, balance and coordination skills. Many times, dressing skills are worked on during occupational therapy or physical therapy sessions to help children to become more independent. That's all. Thank you. Language development, proudly presented by Sirabi Darson L. So we have the introduction, which is the language development supports many other aspects of development like cognitive, social, and literacy development. Language development starts with sounds and gestures, then words and sentences. You can support language development by talking a lot with your child and responding when your child communicates. So, ano nga ba yung maitutulong ng family to the language development? Children of low-income parents are most likely to have language difficulties, while children of upper-income parents are more likely to have above-average verbal skills. So, dito sa research ko is nahanap ko na yung mga kinulang daw sa pera mga parents is more likely nahihirapan yung bata to improve their language. Pero para sa akin hindi naman siguro dahil sa income lang. It depends on how the parents or yung surroundings ng bata kung susuportahan nila ang bata na mag-improve parang sa kanyang language. We also have the body, supports your child's thinking ability and helps them develop and maintain relationships. Language development lays the foundation for the reading and writing skills in children as they enter and progress to school. So, sa body naman, meron din mga language. Meron din kasi mga language yung mga bata which is na-produce nila through body. Tulad ng mga nagsisipa-sipa sila ganyan. Hindi na lahat galing sa boses ng isang bata or sa kanilang the way they speak. Minsan sa body, malalaman mo na sila ay may gustong sabihin. So we also have the intelligence. The study provides evidence that individual differences in language development during the first years of life are associated with intelligence in midlife. Early language development is associated with intelligence in midlife. A total of 6.7% of the variance in midlife IQ is explained by milestones related to language. So, sa sex naman tayo, numerous epidemiological studies, some of which we mentioned in table 1, yung sa table 1 dito sa research ko, found significantly higher prevalence of communication, language, and speech disorders in boys than in girls. Likewise, the normal process of communication and language skills developed is faster and more advanced in girls compared with boys. Tama, na-observe ko rin yun sa aking mga anakin. So we have also the social environment. The more words caregivers use, the larger a child's vocabulary will be. Children with lower socioeconomic status tend to have smaller vocabularies. Language develops better in children who are read to regularly. A rich social environment helps build language skills. We see now more clearly than before that in the preschool years that there are critical periods of mental development. Tama, nakakatulong itong malaki, itong social environment sa mga bata. So we have also the last one, which is the socio-economic status. Family socio-economic status, or SES, is related to language development in multiple domains. Throughout childhood and in adulthood as well, children from lower SES homes show lower levels of language and communicative skill than children from higher SES homes beginning in infancy. Tama din. Kasi depende sa mga nakakasalumuhan ng isang bata or even sa mga adulthood. Bakit? Kasi if they always encounter yung mga for example, na-encounter lang nila yung mga Filipino language, and then hindi sila marunong makipag-communicate sa ibang mga lingwahe or sa ibang mga tribo ng tao. So that's all for this topic. Thank you for watching.
Physical development. It includes both growth and the ability to use muscles and the body parts of particular skills. Both growth, large muscle movement, and fine, small movement, motor skills contribute to physical development. Children often learn a set of skills by a certain age. These are the example of the development of the male. So first we have the rapid skeletal growth. During rapid growth, increased body weight and muscle strength result in increased loads on bone. Bone adapts to this increased strain by increasing bone modeling and remodeling. Enlargement of testes. Near doubling in the size of the testicles and the scrotal sac announced the advent of puberty. As the testicles continue to grow, the skin of the scrotum darkens, enlarges, thins, hangs down from the body and becomes dotted with the tiny bumps. These are the hair follicles. Mustache. A strip of hair left to grow above the upper lip. Pubic hair. Pubic hair is a terminal body hair that is found in the genital area of adolescent and adult humans. The hair is located on and around the sex organs and sometimes at the top of the inside of the tights. Increased musculature. Acne develops when sebum, an oily substance that lubricates your hair and skin, and dead skin cells plug hair follicles. Bacteria can trigger inflammation and infection, resulting in more severe acne. In female development, first we have the breast budding and menstruation. The enlargement of breast and menstruation start. Hips development. From 8 weeks of development to adolescence, further growth of the hip is focused on differentiation and the establishment of the adult arterial supply. The postnatal growth of the child hip is the product of canter and accetabular and proximal femoral growth from their corresponding growth plates. Pubic hair is a terminal body hair that is found in the genital area of adolescents and adult humans. The hair is located on and around the sex organs and sometimes at the top of the inside of the tights. Develops body figure. Female body shape or female figure is a cumulative product of women's skeletal structure and the quantity and distribution of muscle and fat on the body. There is a wide range of normality of female body shape. Female figures are typically narrower at the waist than the bust and hips. Intellectual development. Cognitive or intellectual development means the growth of a child's ability to think and reason. It's about how they organize their mind, ideas, thoughts to make sense of the world they live in, begin to reason and argue, uses words like why and because, understand concepts like yesterday, today, and tomorrow.
Good day, everyone. I am Judy Ann Rodriguez Manuel. I will going to discuss about the language development. Language development from birth on children are programmed to develop speech and language. The first 5 years are the most critical, but language development continues throughout early childhood and into adolescence. In the early stage of language development, the brain is programmed to attend to speech sounds and begin to mimic them. Language development category. First is may not like to communicate to adults. Next is enjoy talking with friends. Often argue rather than discussion. Usually does not like grammar. May complain that others do not understand. Last is conversations are often social matters. We have also emotional development. Emotional development is a complex task that begins in infancy and continues into adulthood. The first emotion that can be recognized in babies include joy, anger, sadness, and fear. As children's sense of self develops, more complex emotions like shyness, surprise, elation, embarrassment, shame, guilt, pride, and empathy emerge. The emotional development category are the following. First is adjustment to a new body image, adaptation to emerging sexuality, establishment of emotional separation from parents, establishment of a personal sense of identity, further separation from parents, interest in forming romantic relationship. Part of separation task implies from separation from family. We have also social development. Social development occurs throughout life and explains how we recognize, interpret, and respond to social situations. Healthy social development is a known protective factors for children's and young people's mental health and well-being. Social development category: strong fear effect, increased health risk behavior, sexual interest in fear, early vocational plans, increased impulse control, emerging social autonomy, establishment of vocational activities, and bullying. That's all. Thank you.
Good day, everyone. I am Darson Elam Serabi. I am going to present you about moral development. So first, we have the wants to be a nice person. Behavior is determined by social approval. The individual wants to maintain or win the affection and approval of others by being a good person. We also have the personal choice. Moral rules involve the most basic and socially strict guidelines and societal prohibitions that may never be broken. Finally, personal choices involve rules that do not have fixed socially prescribed answers at all, but instead are left up to personal preference. Reasons to be good. True moral behavior involves a number of internal processes that are best developed through warm, caring and parenting with clear and consistent expectations. Emphasis on the reinforcement of positive behaviors rather than the punishment of the negative ones. Modeling of moral behavior by adults and creation of opportunities. So, dito rin nagbe-base yung mga bata sa mga magulang nila. Through warm, caring parenting with clear and consistent expectation. We also have the physical and psychological. Moral development refers to the process through which children develop the standards of right and wrong within their society based on social and cultural norms and laws. So, kung ano nakikita ng bata na bawal o mali, doon sila sumusunod sa kanilang paligid. We also have for many years, character or moral development has been cited as one of the many benefits of an effective physical education program. Essentially, character development is about helping students to become better human beings as it emphasizes moral traits such as kindness, respect, and fairness. We also have the masculine perspective versus feminine perspective. So first, it aims to understand the nature of gender inequality and examines women's social rules, experience and interests while generally providing a critique of social relations. Much of feminist theory also focuses on analyzing gender inequality and promotion of women's interests. So masculine perspective, since oppression often involves ignoring the perspective of the marginalized, different approaches to feminist ethics having a common commitment to better understand the experience of persons. The experience of persons oppressed in gender ways. In broad sense, then feminist ethics is fundamentally political. So we have also the minority cultural. Minority, a cultural, ethnically, or racially distinct group that coexists with but is subordinate to a more dominant group. As the term is used in the social sciences, this subordinacy is a chief defining characteristic of a major
minority group. As such, minority status does not necessarily correlate to population. So what is premarital sex? Premarital sex is sexual activity which is practiced by people before they are married, yung mga magjowa. In some period of human history, in some societies, premarital sex has been considered as moral issue, which is taboo in many cultures, and it's also considered a sin by a number of religions, like for example, the Muslim or Islam. But since the sexual revolution of the 1960s, it has become accepted by certain liberal movements, especially in Western countries. So what also is the homosexuality? Homosexuality is an enduring pattern of emotional, romantic, and or sexual attractions to people of the same sex. It also refers to a person's sense of identity based on those attractions, related behaviors, and membership in a community of others who share those attractions. Along with bisexuality and heterosexuality, homosexuality is one of the three main categories of social orientation within the heterosexual and homosexual continuum. That's all for my... And that's all for my topic, moral development. This is Sir Abby Darson once again. Thank you for watching.